Today is the 10th of June 2025, and we are once again turning our attention to the persistent challenge of COVID-19. In Bangladesh, a nation that has navigated the complexities of this pandemic with resilience, there are new signs that demand our close observation. Recent data from the Directorate General of Health Services, or DGHS, reveals a concerning trend. Over the last 24 hours, 13 new cases have been confirmed, but the more telling figure is the daily positivity rate. This rate, which indicates the percentage of all coronavirus tests performed that are positive, has surged to 8.62%. This is a significant jump from the 5.14% recorded just the day before, signaling a potential acceleration in community transmission that cannot be overlooked. This uptick is not an isolated event, but part of a pattern that has been developing over the past week. Health officials recorded 5 cases on June 9th and 3 on June 8th, with a single fatality reported on June 5th. While these numbers may seem low compared to the pandemic's peak, the sharp increase in the positivity rate is a classic early warning sign. It suggests that the virus is spreading more efficiently among the population being tested. Experts on the ground also caution that the official figures, which now bring the country's total confirmed cases to 2,051,760, might not capture the full picture. A reduction in the number of people seeking tests could mean the true extent of the spread is greater than what these numbers show. Adding another layer of complexity to this situation is the confirmed presence of new subvariants of the Omicron strain. Genetic sequencing efforts within Bangladesh have identified several new lineages circulating, including JN.1, LF.7, XFG, and NB1.8.1. These are descendants of the highly transmissible Omicron variant, which has continuously evolved since it first appeared. The detection of these specific subvariants is a critical development because each new version of the virus has the potential to behave differently. It could be more transmissible, better at evading the immunity we have built from past infections or vaccinations, or it could cause different symptoms. This viral evolution is why constant surveillance is absolutely essential for public health planning. The arrival of these new subvariants serves as a stark reminder that the SARS-CoV-2 virus is far from static. It is a dynamic and ever-changing threat that requires a dynamic and ever-adapting response. While the country's official death toll has thankfully remained stable at 29,500, with no new deaths reported recently, the rise in infections and the introduction of new viral forms necessitate a renewed sense of caution. The history of this pandemic has taught us that a surge in cases can often be a precursor to an increase in hospitalizations and, tragically, deaths. Therefore, understanding the characteristics of JN.1 and its counterparts is a top priority for scientists and health authorities in Bangladesh right now. In direct response to these worrying signals, the Directorate General of Health Services in Bangladesh has reactivated a series of public health advisories aimed at curbing the renewed spread of the virus. The government is not taking these developments lightly. Health officials are strongly urging all citizens to return to a fundamental and proven method of protection: wearing masks. This simple measure is particularly recommended in crowded places, such as markets, public transport, and indoor gatherings, where the risk of airborne transmission is significantly higher. The message is clear and direct. The pandemic is not over, and personal responsibility is a crucial line of defense for the entire community. Beyond individual protective measures, the DGHS has also issued guidance regarding movement and travel. The public is being advised to avoid non-essential travel, especially to countries that are currently experiencing their own significant surges in COVID-19 infections. This advisory is a proactive strategy designed to limit the importation of new cases and potentially other novel variants that may not yet be circulating within Bangladesh. By discouraging unnecessary travel, authorities hope to slow down the virus's pathways and buy valuable time to reinforce domestic public health measures. It is a preventative action that reflects a lesson learned from the early days of the pandemic, when global travel was a primary driver of the virus's rapid spread across borders. The government's response extends to strengthening its surveillance and monitoring systems. This is a critical background activity that helps officials track the virus in near real time. By enhancing the capacity to test, sequence, and analyze cases, authorities can get a clearer picture of how the new subvariants like JN.1 are behaving and where they are spreading most rapidly. This information is vital for making informed decisions, such as where to allocate healthcare resources or whether stricter localized measures are needed. It is this behind-the-scenes work that underpins an effective and targeted public health response, moving beyond broad mandates to a more data-driven approach to managing the ongoing threat. This renewed call for public vigilance is a delicate balancing act. After years of living with the pandemic, there is a natural sense of fatigue among the population. However, the current rise in the positivity rate and the presence of new variants are a clear indication that now is not the time for complacency. The advisories from the DGHS are not just recommendations, they are urgent appeals for collective action. The success of these measures depends entirely on public cooperation. By embracing mask wearing again, reconsidering travel plans, and staying informed, every individual can play a part in protecting themselves, their families, and the nation's healthcare system from being overwhelmed by another wave. Anticipating the potential for an increase in patients requiring medical care, health authorities have placed hospitals and healthcare facilities on a heightened state of alert. The DGHS has issued directives instructing hospitals across the country to ensure they are prepared for a possible surge in COVID-19 admissions. This involves a comprehensive review of their readiness, from checking the availability of beds in intensive care units to ensuring a stable supply of medical oxygen and essential medicines. The goal is to avoid the frantic scrambles for resources that characterized earlier waves of the pandemic. Preparedness is key, and these instructions are designed to make sure the healthcare system can absorb a potential increase in patient load without compromising care. A central pillar of the renewed strategy is the vigorous promotion of vaccination, specifically with updated booster doses. The scientific consensus is clear. Vaccination remains the most effective tool for preventing severe illness, hospitalization, and death from COVID-19. Health officials are particularly encouraging the public to receive updated booster shots that are formulated to target newer strains, such as the XBB subvariant and its descendants. While the currently circulating variants like JN.1 are relatives of Omicron, vaccines tailored to more recent versions of the virus can offer broader and more robust protection. This push for updated boosters is about staying one step ahead of the virus's evolution. The vaccination campaign is focused on ensuring that as many eligible people as possible, especially the elderly and those with underlying health conditions, receive this enhanced protection. These vulnerable groups are at the highest risk of developing severe complications if they become infected. Public health messaging is being amplified to explain the benefits of the updated vaccines and to address any lingering hesitancy. The aim is not only to increase the overall vaccination rate, but also to ensure that the immunity within the population is as current and effective as possible against the very variants that are now causing concern in Bangladesh and around the world. This dual strategy of reinforcing hospital preparedness while simultaneously pushing for updated vaccinations forms a robust defense against a potential new wave. One part of the strategy prepares for the worst-case scenario, where infections lead to a rise in hospitalizations, while the other part works actively to prevent that scenario from happening in the first place. It acknowledges the reality that infections may still occur, but it focuses on mitigating the most severe consequences of those infections. For the people of Bangladesh, this means that getting vaccinated and boosted is not just a personal health choice, but an act of solidarity that helps protect the nation's entire healthcare infrastructure. The situation in Bangladesh is not happening in isolation. It is part of a global pattern of viral evolution that international bodies like the World Health Organization are monitoring with extreme care. The WHO plays a crucial role in this process by categorizing new variants based on their risk profile. For instance, the XBB variant and its sublineages have been classified as variants of interest. This designation serves as a global alert, signaling to countries like Bangladesh that these strains require close monitoring due to genetic changes that could affect their transmissibility, severity, or ability to evade immune responses. This framework helps coordinate a synchronized global effort in surveillance and research. The detection of variants like JN.1, LF.7, and XFG in Bangladesh underscores the importance of this continuous global surveillance. Viruses do not respect borders, and a variant that emerges in one part of the world can quickly spread to another. The WHO's classification system provides a common language and a clear set of priorities for health authorities everywhere. It helps scientists in Bangladesh compare their local findings with international data, allowing for a better understanding of how these new subvariants are likely to behave. This collaborative approach is essential for developing effective public health strategies and for adapting vaccines and treatments as the virus continues to change. Looking back, we can see how far we have come since the first COVID-19 case was detected in Bangladesh on March 8, 2020. The journey has been long and challenging. However, the current situation, with its rising positivity rate and new variants, serves as a powerful reminder that our journey with this virus is ongoing. The need for vigilance is as critical now as it was in the beginning. Controlling the spread requires a multi-pronged approach that combines government action with individual responsibility. This includes robust government monitoring, widespread access to testing, and clear public health communication about the risks. Ultimately, navigating this new phase of the pandemic depends on our collective commitment to the tools we know work. Vaccination, particularly with updated boosters, remains our best defense against severe disease. The simple act of wearing a mask in crowded settings can significantly reduce transmission, and staying informed through reliable sources allows us to adapt our behaviors to the current level of risk. The information about COVID-19 is constantly evolving, and as we learn more about these new variants, public health guidance may change. Therefore, it is essential to stay aware, be prepared, and continue to take the necessary precautions to protect ourselves and our communities.